Good evening, everyone. Welcome to the University of Louisville School of Nursing's open house. What we're here tonight to talk about all of our programs. We have a number of exciting programs here at UofL School of Nursing. We've got faculty here who are also excited, and some students who can give you guys all the information that you need for assistance. So, for those of you who have been with us before, welcome back. We're really glad to see that you came back to learn some more information. And for those of you who it's your first trip to the University of Louisville, well, we'd love to give you a tour. Oh, by the way, I'm Lee Reisner. I am the Associate Dean for Graduate Programs, which we have two. Our Doctor of Nursing Practice, which we kicked off last year, and Dr. Sarah Roberts is going to tell you about that. And then our PhD program, which is in its 11th year now, and we've had 15 graduates, I believe. And Dr. Becky Christian is going to talk about that. I'm just kind of looking to see if the dean was here. Hopefully you guys got a chance to meet Dean Hearn at either the reception or one of the other programs. But we do have representatives from our Office of Student Services here. We have Jessica Jackie, who is, so hello Jessica, who works with our DNP students, our Master's Degree students, and then Trish Hart, who is our Assistant Dean for the Office. She works with everyone. So I'm just going to turn this over to Dr. Christian and say,
Thank you. Thank you, Lee. I'm sorry my voice is a little scratchy. It's allergy time. I do want to, you can't hear me. Can you hear me now if I talk into this? Is that better? Okay, sorry about that. I do have allergies, so I apologize. I want to recognize the faculty who are here, so that they wanted to come and meet you tonight. So if you could just stand and say your name, or say your name and wave your hand briefly, it would be helpful to people. Yeah.
Barb Luca. Celeste Schaller.
Diane Schlabowie.
Kathy Batra. Lynn Hall.
Okay. And Sarah, he's already introduced Sarah. Is that it? Everybody else? Okay. Well, it's always nice for you to see faculty in the programs. Okay, so let me just give you a brief overview of the PhD. I'm sorry, this is the wrong set of slides. Sorry. I know. It's the wrong thing. It may be that. Sorry about that. You know what? I think I have to go upstairs because it's not on this. Isn't that weird?
I can go first.
Okay, we will have to do that because it is not on this one. Okay.
We're nurses. We're flexible.
I could do it without the slides, but I really made good slides, so I really want to show you. So let me just take this out. Sorry about that. The best laid plans. Do you have slides?
Yeah, I have them. They're there. I'll get them.
Okay. So we'll try again. Thanks.
Okay. Okay. So again, I'm Dr. Sarah Robertson. I received my Master's of Nursing 14 years ago now. I've been a nurse practitioner for 14 years. And only recently, of course, when I graduated, there was no Doctor of Nursing practice. And I recently, in 2013, received my DNP. I am the coordinator of the Family Nurse Practitioner track here at the University of Louisville. And part of my time I spend teaching. Some of you might know me from teaching your pharmacology or pathophysiology class. Oh,
I need to use the mic.
Oh, usually no one says anything about me not being loud.
Usually that's not a problem I have. Seems loud. Where was I? Oh, and those are some of the core classes that I teach in the doctorate program, so patho and pharm. So I'd like to welcome you first off, and a couple of questions that you might have. I hope to answer those in this little short presentation. I won't keep you too long and try to give you the essential information. So why the DNP? Well, in 2004, the American Association of College of Nursing endorsed the position that DNP is the most appropriate degree for APRNs. So you're kind of getting in a little bit on the beginning of this, that our major organizations decided that if you're going to be a nurse practitioner, this should really be a doctorate degree. That is the suggestion. It's not mandated at this point. Some schools are graduating Masters of Nursing nurse practitioners. However, really the new standard that has been set is that the Doctorate of Nursing Practice is the entry level for advanced practice nurses, nurse practitioners. And this was for a couple of reasons. First off, as always, nurses weren't really giving ourselves credit for what we were doing. Our master's programs were almost as many credits as most doctorate programs anyway. We did not have to add that many credits to create a doctorate program. So who wants to do a master's program that's this much short of credit hours when you can do a little bit more and do the doctorate? And then also, you know, what's added on in the doctorate program really makes you a more robust provider. It introduces other aspects of healthcare, like a greater emphasis on the healthcare system as a whole and how can we impact that system, health policy, and a real focus on evidence-based practice and how we can be change agents in the clinical setting, not just participants. So some factors leading to the DNP: complexity of care, obviously the system with which we work in, needing better knowledge of information sciences, IT with all the data that's out there, how do we process that data that's coming at us from all directions all the time. When we were looking at equal disciplines to us, the physical therapy graduates their entry to practice with a doctorate. Pharmacy graduates their entry to practice with a doctorate, and we needed to kind of realize our potential and what we were doing and what we're bringing to the table, and so it made sense that we would have that level of preparation as well as nurses. The Doctor of Nursing Practice program is first and foremost to prepare you clinically to be an advanced practice registered nurse or nurse practitioner. If you are already, do we have any MSN to DNPs in here today? Okay, so I won't even talk to that. That's okay. So first off, to be a nurse practitioner, but also with a focus on the additional evidence-based practice and the project, you're really looking to develop a level of expertise in a certain area that you're interested in. So you're going to do your general clinicals, but then when you start to look at one area, and when I mean an area, I don't mean like family. I mean like a small niche that's yours, that you can kind of look at the evidence of practice, look at how that's being, how physicians and nurse practitioners and all providers are maybe performing certain tests or certain skills, and you see the evidence that says this can be done better, this can be done different. So you become an expert in that area and you become a change agent through your project. And so that's the kind of additional development that we're looking for with the Doctorate of Nursing Practice, as opposed to the students that were graduating at the master's level. The program also has the project should impact practice. So some ideas for that would be program development and evaluation. So how do people in the clinical setting do things? How could they do it better based on the evidence? Maybe some health policy changes that could impact, health policies that would impact healthcare, or make people safer, or impact the way someone's going to receive healthcare from a policy standard that increases population health. Those are some things. And then you can also look at your project through a information technology piece, if that's your thing. So there's lots of different avenues in which, and this is kind of where you're becoming your own expert. You're developing that expertise, either in program development, or maybe you want your expertise to be in health policy or IT. And so that's kind of how that project unfolds as you do that. The program goals: synthesize and apply knowledge to improve population outcomes, collaborate with other disciplines, and that's obviously should be and is very much emphasized right now. Nobody can take care of patients well alone. We all need specialists, we all need each other. So of course that's important. You're going to be develop your competencies in the clinical setting, but also develop your leadership skills, more knowledge on policy, and this degree would also enable you to have more of the skills if you wanted to take on a teaching role as well. Brooke, were you trying to ask a question? Or maybe your microphone just came on for a minute. I think she's okay now. We'll assume you're okay. Our first cohort was in 2016. We just accepted them. There is approximately 40 of them. And they are right now moving their way through the program. And we have two options. As I discussed, we have the MSN to DNP, which is someone who's already a nurse practitioner. And then what most of you are here for, which is the BSN to DNP. We have 5 different specializations. The first is adult gero primary care. So it says adult gero, but this actually goes down to the age of 12. So it's teenagers and up. The piece that you're missing with that is the 11 and under, so real peds. Family, which includes the 11 and under. Psychiatric mental health, adult gero acute care, and neonatal nurse practitioner, which is an every other year admission cycle. The next admission cycle for neonatal will be in 2018. I do want to take just a minute to talk about choosing what track. Sometimes I think a lot of times people choose family because they don't know what else to do, and people said, well, just choose family, that's what you should do. I do want you to know that there's a lot of value in each of these tracks. First and foremost, if you really aren't interested in working with kids and you don't really want to do much clinicals with kids, then you don't have to do family. It's not really going to open up any more doors from you. And actually, there's a very high demand for adult gero, more kind of like internal medicine specialty nurse practitioner positions. So if you want to see adults in pulmonology and you want to do pulmonology, there's not really any reason to be a family nurse practitioner unless you want to see kids in pulmonary. Okay, so really think about, as you're kind of in this process and of applying, what you want your practice to be like. The other thing that you need to choose is, do you really want to be in the hospital or do you want to be in the outpatient setting? It used to be you could get a family nurse practitioner and kind of work anywhere in the hospital outside. That has changed. You have to have the preparation for where you are wanting to work. So if you want to work in the hospital, if you want to be a hospitalist, if you want to do pulmonology in the hospital, like intubating people and checking lines and all that stuff, then you have to be an acute care nurse practitioner, okay? If you want to see patients in a pulmonary clinic, then that's a family or an adult gero nurse practitioner. So one of the things that you really need to decide early on is, what do you think that you want your career to look like? Because that is a very divergent road, okay? And so you want to make sure you pick the one that reflects what you want to do. There's several things that go into that. Schedules, there's less call sometimes in primary care, more nights in acute care. But if you want to do acute care, then that's what you want to do. That you're going to be there. That's your thing. So, but those are all things I think you need to consider. Let's see. I think I addressed most of that. The BSN to DNP is 3 years of full-time study. The good news is you are only taking 9 to 10 credit hours a semester. I know that kind of sounds like a lot, but it is not overwhelming. Early on in your in this time, it's reasonable to work some. Some people can work more than others. I think it depends on how recently you went to school, and is this going to be like a big challenge or a change for you to go back to school, or are you kind of already in the mode and you can work a couple days and feel like that you do well? So that's really a personal decision, but each of the semesters is not overwhelming. The total clinical hours are just about 1,000 to 1,086 clinical hours. That's going to include clinical hours that you get in the practice setting, so that's working with patients, and it's going to include about 330 hours that you'll log that you've worked on that project that I was talking about, your expert program change project. What makes UofL the best choice for you? I think there's a lot of things that we have a lot of positive things going on here. First is we have a hybrid delivery model. So that means that you come to class 5 times a semester, okay? And the rest of the content is delivered online via various ways. It may be integrity lectures, it may be specific readings, it may be certain assignments that you work through material. So when you are here on, generally it's a Thursday, you are here all day because each of your classes meet on that one day, but it's only 5 times a semester. Okay. The curriculum, I want to show you how to get to this, so I didn't bring it up on purpose. So you want to go to louisville.edu and then nursing. Academics, and then BSN to DNP program. And you will have all these tabs that give you a lot of the information that you need to know. Okay, I'm going to pull up the curriculum. I'm going to pull up the family just for a reference point. Some of the things that I feel like are really highlights to our curriculum is that we have some additional kind of core classes that are clinical practice-oriented classes that you might not see in other curricula from other institutions. And a couple of these, you notice that you have adult health, and then you have an additional procedures class. We've given you a whole another 2 credit hours in women's health, which is great because I don't think you imagine when you get into primary care how much women's health you're actually going to do, even if you're not a women's health nurse practitioner. It's a lot. Also, there's a 2-hour diagnosis and management for mental health. Very few programs are going to offer that type of additional mental health training for primary care providers, and that's going to be an exceptional class as far as giving you the tools that you need, because everyone that's in primary care will tell you that they see diabetes, they see hypertension, and they see psych. So, and oftentimes psych is kind of the piece that gets missed, and then you're kind of just floundering out in the community once you're a practitioner, like, okay, I can deal with this person's hypertension, but what do I do with this person's depression right now? So we want you to know that if you come here, you're going to be a very well-rounded and prepared. I think you're also, if you are a family, you're going to get an additional pediatric well child and pediatric diagnosis and management course as well. Okay. Most of this is going to be your prereqs up here in your early years, your fall, spring, and summer of your first year. And then as we kind of go down here to your last years, when you're really going to be working on your project and doing your patient care clinical practicum as well. Okay, so there's going to be less coursework at the year 3 and more practicum work at that time. Okay, the last thing that I wanted to talk about is admissions. The application deadline is February 1st. There's only fall admissions, so don't think that you're going to wait and do spring next year or something like that. It's only fall admissions. And this is, I'm not going to obviously go through this, but this is where you're going to find everything exactly what you're going to need for the admissions process. Jackie is your best friend when it comes to that. If you have any question at all, do I need this transcript? Does this course count? Anything you could possibly need, she is going to have the answer to that. And if she doesn't have the answer to that, she will find the answer to that for you. So you do not have to worry. She is your point person. A couple of things that I just want to highlight is, really think carefully about who you want to write your letters of recommendation. Some people take attention to that, and some people write a 4-paragraph. And I think that's something that really makes a difference when we're looking at candidates. We really want someone who knows you and is going to really express to us why they think you're going to be successful in this program. Okay. Also, the other thing that really is going to highlight you, this is not a time to be humble. Okay. This is a time for you to shine, is your goal statement. I think sometimes maybe for other things, you're like, well, I'll just kind of say I want to do this and, not really put a lot of attention into it. This is going to be something that you're really going to put a lot of attention to, because this is where we're really getting to know you and making sure that we feel like this is the right fit, that you've thought about this, that you know why you're coming to this program and really where you see yourself going with this program. Okay. I think that was it. Of course, we have faculty with a wide range of expertise to help you complete your DNP projects. We have many, I don't know how many, doctoral prepared faculty, plenty, to help everyone get through their project. We have a health science campus, so we have lots of associations and connections with the local hospitals and communities to help you place you for your project and your clinicals. Here's our DNP faculty, and that's it. So I think I should take questions at the end, and so we'll let Dr. Christian go, and then we'll take some questions at the end. Thank you so much for your time and attention. I appreciate it.
If you would like a printout of those admissions requirements, she mentioned that out over on that table, so you just wanted to take it. Also on the website.
Say a prayer. Yeah. And this is the correct one. So thank you for bearing with me. But I was able to bring another piece of information that I didn't bring before. I'm Becky Christian. I'm the PhD program director now. I took over from Dr. Carla Herman in July, and I wanted to talk to you a little bit about what we offer and the differences between DNP and PhD education. And they're really different. We want you to come to our school, so we care. We don't care really which program you go into, but we want you to be in the right program. So that's why we like to have a combined session like this, because they're different. And so we want to meet your needs the best way that we can. Excuse me, that we can. So I thought I'd show you a few little things about what we do and what we're about. So here, Sarah probably already talked about this because I didn't hear her first part, but we are a diverse university, so that's an important thing for us. We're metropolitan. We're an academic health sciences center as well. A lot of schools aren't academic health sciences centers, so that means that you're going to have a lot of opportunities to do practice and conduct research in these different settings. We are a doctoral research university, or a R1 university designated by the Carnegie Foundation, and that means that it's the highest level of research in the country. So there are just certain universities that do this. So there's a lot of funding. Last week we just had Research Louisville, where people share the outcomes of their research. And so we had some of our students at Research Louisville last week, so you will be able to participate in that as well. We are also part of the School of Interdisciplinary and Graduate Studies, and we offer the Doctor of Philosophy or the PhD degree in nursing. And so there are two pathways for doctoral education in nursing. And I'm talking about the PhD or the Doctor of Philosophy degree. And our focus is really research. So if you're not interested in research, you don't want this degree. But we're going to convince you that this is the degree that you want. Because you have to understand, all of us who are researchers, we come from clinical practice. So we try to make our research relevant for practice and so that we can translate it to practice. So even if you think you don't want to give up clinical, well, you don't have to necessarily. So please don't think that just because we teach or we do research that we are not interested in practice. And so our School of Nursing then, this is our little tagline, called by compassion and destined to discover. And we really do believe that. So if we look at the goals for doctoral programs that are research focused, this comes from the AACN, and these are the pathways to excellence. So what our goal is then, and this is true across the country, so whatever program you go to, this is the goal that we have for a PhD in nursing, is to prepare nurse scientists and scholars. So we have some in this room who are in the process of becoming nurse scientists and scholars. We focus on scientific content, so we have a lot of courses on research methodology and statistics, so that's another difference between the PhD and the DNP. We try to generate clinical nursing research, so it's really about the science of discovery, so we're really focused on generating that research. And then a lot of us translate nursing research to clinical practice. So it's really important for us not to let that sit on the shelf and not be used in practice or in other settings. So it's really important to translate what we find into other settings. And so what this allows us to do then as scientists and scholars is to advance nursing science through this scholarship of discovery. And the original dissertation research that students do is either a traditional dissertation or there's an option to do linked research manuscripts. So it's up to you and your chair how you decide to do that, but we do have both of those options for you. So here's our current cohort of students. You may have seen some of these people in the room, so I just wanted you to see what they look like. And so they do survive the program, so they're currently in our program now. Although the man on the end, Mohammed, just graduated, I think, not too long ago, this year. So building on what I just said about what our goal is then, it's to generate knowledge, and we design and test interventions. So you think about the interventions that you do as a nurse in clinical practice. Well, we set up studies to test these different interventions to see which one works better. So that's really our goal, is to find the right interventions, design the interventions. And we evaluate outcomes to reduce risk of illness and disability, as well as promoting quality of life. We like to do interprofessional collaboration. And when the DNP degree was designed, part of the goal of the DNP was to collaborate with PhDs. So the ideal research team has a PhD person and a DNP prepared person on the team because they're the most current in clinical practice. So then we add other disciplines like psychology or social work, biostatistics, and then we get a better outcome if we do interprofessional collaboration. We also prepare people to assume leadership roles in research, in teaching, in practice, administration, and public policy. In other words, you can do everything when you graduate with your PhD. A lot of us like to be academic nurses, so that means that we teach as well as do our own research, and some of us practice at the same time that we do all these other things. There's also a way for you to focus on health policy and using the scientific knowledge and the evidence to convince the funders and the decision makers, say in the legislature, that these are the best strategies to use. So that's another way that we can affect change in health policies. So I thought I'd give you an overview. This is kind of crazy, but I can reduce it to two categories. And so all the PhD program faculty here are nurse scientists and scholars, and they have different research expertise. So they have a population of interest, and they may have more than one, and then they also have research focal areas. So if you look at that list, you should be able to find yourself on both sides of this screen. So for example, I'm a pediatric person, so I look at children and adolescents and families, and then I also do chronic health conditions and quality of life and some self-management. So you can find where you fit, and then once we know what your interests are, we try to match you with faculty to help you achieve your goals in terms of research. So that's kind of a complicated slide, but I think it really displays what our faculty have to offer in terms of their focal areas for research. So here, we are all members. Our region is the Southern Nursing Research Society region in the country. So our students will present at that session. We also are on the border with the Midwest Nursing Research Society. So sometimes we'll go to both meetings. So here's Dr. Vicki Hines Martin with two of her students who actually have both graduated from our program. So I thought you might like to see that and notice the location. So there's some good locations where some of these meetings are. In terms of our program of study, we have two pathways for that as well, just like the DNP. So we have the BSN to PhD, which is really 3 years of coursework. The first year is at the MSN level. Year 2 and 3, those are the PhD level courses, and then you do your dissertation after you finish coursework. The MSN to PhD, you can just see the first bullet points dropped off, so you do the 2 years of coursework and your dissertation. There is an option to go part-time, so don't think that you have to go full-time. Of course, we'd rather you go full-time because you're going to finish through, and the sequencing of the courses is a little better for you. So, but it is an option. So if you need more information about that, you can ask us, or I can meet with you personally. We had Research Louisville last week, and here are 3 of our PhD students who were presenting at that, and I think several of them are here tonight, so that was a good picture. And then our Adam Booth won the first place poster award for the School of Nursing. So he's a PhD student and a Jonas Nurse Leader Scholar. So there he is. He didn't know I was doing this. I embarrassed him now. And then we also had 2 of our faculty win first place for posters. So Heather Owens graduated in May. So this is her dissertation research that she's presenting on the left side. And then on the right, Heather and Luz Huntington Moscos, they shared the first place award, and Luz did her postdoc work, but I also taught Luz at a different school, so she came here afterwards. So it's a small world. So don't burn bridges because everybody knows everybody. This is kind of how you progress through the program. So we will assign you an advisor based on the interview that we do with you and your personal statement. So we try to match you, but it may not be perfect, and it may be that you switch to someone else for your dissertation chair, which is, excuse me, perfectly fine. You're going to complete your coursework regardless of which program, so 2 years or 3 years. And then there's a residency requirement that you have to do, which means you have to stay enrolled until you finish your dissertation, and there's a time period. There's a written qualifying exams that you do, and you also do an oral defense. So that's with your dissertation committee. You also can do those scholarly presentations at research conferences. So that's what they were doing last week, and they'll be going to other places. So we have the Southern Nursing Research Society coming up in the spring, and as well as the Midwestern one. And then everybody does a public defense. So anybody from the university can come and hear you with your final defense. And then you have a private session with your committee. And then you graduate. So that's exciting. And here's some people who went to the Midwest Nursing Society. Now, these are all 3 of our PhD students, and they were actually, I think, manning the booth, quote unquote. So we always do recruitment sessions and things like that. We have options for fellowships and assistantships. You do have to apply for those when you apply for admission into the program, but we have graduate research assistantships, and you can work in the research center and work on people's studies. You can do a graduate teaching assistantship, so you learn how to teach, and you work with some of the other faculty. You can apply for the Jonas Nurse Leader Fellowship, so that's after you're in the 2nd year of the program. We have a new scholar that's called the Health and Social Justice Scholar. And one of our students got that, and this is the inaugural year for that, so that's a university level. And then there's fellowships within the School of Interdisciplinary and Graduate Studies, so they call it SIGS, so that's what SIGS means, but that's too long to type. But there's a lot of different fellowships, and you can see they're awarded fairly early in January and February. And then they also offer some other opportunities for professional career development. There's the University Writing Center that's available to you. All of these things are free to you. Excuse me, Graduate Teaching Academy. So if you're interested, you can look this up on the website. So here's our hooding last May, and Dr. Ashley Miller was hooded, but she also won this university level award, which is the Guy Stevenson Award for Excellence in Graduate Studies, and that's for excellent research as well as leadership. So she did all these neat things, and she's in women's health, and so that was kind of a neat photo. And then we have our Jonas Nurse Leader Scholars. So Adam Booth and Andrew Flynn are here, and they're going to talk to you. And I think this is where I wanted you to come up and share your ideas a little bit, and then I'll finish this up. So if you don't mind, thank you.
Hello. Do you guys need me to use the mic as well, probably, just for sake of argument? Okay. I'm also usually louder than necessary. I was actually making a couple notes that I wanted to comment on what Dr. Christian was talking about. Again, I am one of the Jonas Nurse Scholars, which, again, I'm very grateful for the university for applying for that, and then I'm also grateful for them to give me that opportunity to partake in that. The reason I comment on that is because, as Dr. Christian was commenting, we have a lot of fellowships at the university, and I don't sit on any of those boards, so I probably can't tell you all the intimate details of them, but I do know that there are scholarships and fellowships and assistantships for individuals who are looking to go into the research level of nursing. There's a lot out there. And there aren't very many of us who enjoy actually kind of diving in and doing the hardcore research that is so readily needed, and specifically needed from a nursing perspective, because we have many other fields and disciplines that we frequently go to when we're trying to find out what we should be doing, what is the best practice in certain situations. And we frequently have to rely on physicians and other fields within healthcare. And there's nothing wrong with that. We obviously want to collaborate with other individuals, but without having individuals who are nurses and have a nursing perspective on the issues that we're addressing, I think sometimes a lot of things are missed. So I know Dr. Christian wanted me to comment a little bit about why maybe I chose the PhD over a DNP track. And I guess full disclosure, I went to Bellarmine earlier and got my bachelor's, and then I went to Bellarmine and got my master's as a nurse practitioner. And then I really didn't feel that I was doing what I really wanted to do necessarily, or that I was set up for that. And I decided that research is really where I probably wanted to be. So had I have made that decision earlier, that might have, again, maybe made me make this jump first. And I guess I don't know if you're interested like me in doing a little bit of both, practicing and also doing research eventually. I'm not sure doing one before the other is necessarily better. I imagine that maybe doing your PhD first might make it easier to do your doctoral project. For your DNP second, I'm not sure, but you'll have to find someone who's done it that direction. I ended up choosing UofL, even though I'm not originally from here. I'm originally from North Dakota and grew up mostly in Canada, but Bellarmine kind of brought me to Louisville, and I chose UofL over UK. Actually, one of the reasons was because of the location. So I don't bleed red or blue. I don't. In Canada, we don't have rivalries like that. So it's really bizarre to me that you guys hate someone in your own state. That's bizarre. But the idea is still the same, that it was very convenient for me to be able to, be at an institution as large as UofL with the amount of research that's being done here, close to where I am, so that I could still continue to work and be able to practice at the bedside. The second, actually one of the biggest reasons I ended up deciding to come to UofL was my special interest and focus is in the deaf and hard of hearing. And though I'm not fluent in sign language, I'm hoping to one day be able to practice in that with that group of individuals. And UofL has, again, many different types of programs, not just PhD programs, but different areas of study, both in the undergraduate and graduate level. And we're one of the few one of the few universities in the country really that teach and have an interpreter an interpreter program in ASL. And so I'm able to kind of tap into some of those courses and tap into those resources for the cognates and the special interests that I'm going to need to be able to study that population, that demographic. So when you are looking at potentially going in either to research, or I would even probably say your DNP, you want to make sure that you pick an institution that's going to be able to support you in the efforts that you want to complete once you've finished. So having the resources available to teach you in the area that you're interested is very important. So UofL offers probably one of the widest selections in the state, at least in this region. So I guess put a word in for that. Like I said, one of the main reasons of coming. The only last thing I was going to say is on the SIGs comments. I'm sorry, taking so much of your time, but the SIGs comments that you had made, I have not had an opportunity to go to very many of those. I'm planning on going actually next week. But again, as part of being a nurse scientist is you have to kind of tell people why you're important, and that a lot of times comes with writing grants and being able to fund the programs and initiatives that you have found through your research to be valuable and important. And again, I can never say what SIGs actually stand for, School of Interdisciplinary Graduate Studies. Okay, yes. So the point though is that they offer these programs, like I'm going to go a grant writing one next week that will hopefully help me be better prepared so that when I do graduate and I know that I want to work with the deaf and hard of hearing, it's going to take a lot of money to build a program where we can care for that population base. And I'm probably going to need extra funds that are beyond the scope of the institutions I work for. So having a free avenue for that actually is taught in this building, right where I'm doing all my work, right where it is awesome. So those are just a few of the things I guess I would comment on.
Thank you so much.
Hi, I'm Adam Booth. So I graduated nursing school in 2010 from IUS across the river, and I worked for a long time actually and was taking pre-med classes. Somehow I thought I wanted to do that, but then took some time off and I was like, okay, get centered, and kind of was a fortuitous chance of events. Josh, who was in our cohort together, called me while I was at the grocery store, and he's like, you got to check this program out. So I get online, check it out, and then you tell your parents, you're like, hey, I'm going to be a nurse scientist. Well, what are you going to do with that? And it's just like having that conversation. But, I apply, and here I am. And ultimately I made the decision because the classes are small. There's three people in our cohort. We get one-on-one time with any professor that we need to advance our research interests. I've worked in the ICU, so I'm really interested in moral distress and like ethical issues at the bedside, and how do we address how nurses feel. I want to study nurses and how we can improve practice from that perspective, particularly with like non-beneficial treatment, aggressive treatment at the end of life. So kind of the cool thing about the program is you start in the master's program, and the first year like master's courses, and then it's like, okay, I got a handle on this. And then you start your PhD courses, and it's just like, whoa, what happened? It's like, it's a lot of reading, but you immerse yourself into what you want to do. So it's not all this extraneous information. You tailor the program to yourself. And that's one of the positives for this program. The professors are awesome. Open door policy. So I would advocate the research degree, PhD. So.
Thank you. I didn't pay them either.
Yeah.
I thought it'd be helpful for you to see why they decided to do what they wanted to do, because they were in the same boat that you were a few years ago. So here, again, there is some time for fun. So this is the Midwest Nursing Research Society. So that whole table, it includes faculty and PhD students. And here's our recruiter in chief, the one right in the front. That's Josh that he mentioned. But so there is time, but it's so neat to go to these scientific sessions so that you can really learn about things. Now, let me give you some nuts and bolts. So here's what you really need to know. Our application deadline is a little earlier. It's January 15th. And there's two parts to it. One is to the school of nursing, the other is to the graduate school, the SIGs. There's a handout that you should have gotten that has all these criteria on here. We do need your official transcripts, and you see those GPAs. The GRE is a difference, so we require the GRE. There is a free GRE prep session. It's November 19th, so UofL offers it, but don't take it cold. A lot of people try that. It doesn't work. You don't do well, and you'll just have to do it again because you won't be admitted if your GRE scores aren't good enough. So let me just tell you that now. And the biggest thing that most people have trouble with is they haven't done math like this in years. So if you have forgotten what geometry is like and algebra, you need to refresh. But this course is good. It's taught by a person who's certified by the Educational Testing Service who creates the GRE. So it's really good. It's free. A lot of those courses cost several $100s. So it's available. If you have questions, you can contact Office of Student Services, and they can give you that information, okay? We do require references, and we want them to speak to your abilities. So don't just pick somebody who's a peer that you work with. We want somebody who can really talk about, like your nurse manager, somebody like that. We need your curriculum vitae or a resume. Either one is fine. So that really tells us who you are, what you've done. Some people have published, other people haven't. It's okay. It makes you look better if you have. We don't expect that. We need a goal statement. So this one is real important. So you need to give us an idea of what you're interested in. So are you interested in pediatrics? Are you interested in cystic fibrosis? Are you interested in deaf and blind patients? You really have to give us an idea. You don't have to have what your final thing is really going to be, but we just need to know to help you and for you to tell us why you're interested in this. Okay? We will have a personal interview with you. We try to do them here. Sometimes it doesn't work and we do it by Skype, so whatever works. You do have to have a license and we'll notify you in late spring. But there is a handout, so please look at that. If you have questions about that, we can answer those. Remember that these journeys are big, and when you look at it in total, it looks overwhelming, but it really all starts with one step, and that's really what you want to think about. So our application deadline is the 15th. Those are our 2 websites, and I think I have one more. So my summary is think research, because that's really what we are. We're researchers. So you can see the difference between the DNP and the PhD. And then we hope you begin your journey with us at the UofL School of Nursing. And do you have any questions right now that we can answer? So we'll both take questions. Thank you. Anybody have a question that you have? It doesn't matter which program. We do have handouts for you.
Are those graduate student assistantships only for PhD students or for the?
There's several different levels of them. The person I was going to ask is back there talking. Dr. Reidner, do you have an answer for that?
What was the question?
Graduate teaching assistants available for the DNP
We were
students.
having a different conversation.
Graduate research and graduate teaching assistants for the DNP program.
There are
Teaching assistants.
some, yes.
Yeah, there are some.
We're usually teaching.
And some of the masters can do that too, right? They can. Okay. Thank you. Sorry about that. Anybody else have a question? Yes.
If we have graduated from UofL for our undergraduates, do we still need to submit all of our transcripts from
We need all official. If you've submitted those to UofL previously,
like previously? Okay, but I haven't taken anything for graduates.
right, correct. We should have it, depending on the time frame, but we will let you know. But yeah, we should have it.
So those people who are talking are your best friends. So all of the questions are directed to them because they know how the system works and they can make it work for you. So they're both in the Office of Student Services. Did you get introduced, Trish? Did you get? Okay, thanks.
I just failed to mention that for the psych and the neonatal tracks, those tracks interview more than the family and the adult zero. So depending on what track that you're looking at for the DNP, you might have an interview.
Anybody else? If you leave and think of a question later, you can email me or you can email or call anybody in Student Services.
The admission requirements here, if you like a handout.
You really answered all your questions.
Yeah, wow.
That's pretty good.
There's both of the doctor of nursing practice and the doctor of philosophy requirements in here printed out off the website. And then the PhD is not laid out. I can take the courses, but the courses requirements, you have that laid out. And then the DNP is so that any different specialty you work through. That's why Dr. Larson showed you where to find those on our website. So help yourself play that.
Well, thank you so much for coming. We appreciate it.
Be around if you think of something more personal that you